post 7 days after surgery, we start distracting. So we need to distract this, that is called distraction phase. The first phase is the latency phase. We have done the surgery, we have put the fixator, and now we need to wait for 7 to 10 days, and then we start distraction, that is phase 2. When we are starting the distraction, means we need to separate these two bones at a specific rates, which is usually Hello friends, I am Dr. Sunil Saini, trauma and Ilizarov surgeon, expert in limb lengthening, deformity correction and pain management. I have given introduction on limb lengthening, how limb lengthening have a history, and how limb lengthening all started initially in World War, how because of lots of gap non-union, malunion, deformities, this Ilizarov theory has started a long back, and then how this has been used for cosmetic limb lengthening or stretcher limb lengthening. So in next video, we have studied about what is the science behind limb lengthening, how limb lengthening is possible, how everything get lengthened. And today we are coming to a very important topic of methods of limb lengthening. So whether you are going for cosmetic limb lengthening or stretcher limb lengthening, or if you have any limb length discrepancies, the methods always remain same. So there are various methods of limb lengthening, in which one is pure Ilizarov method, where we are just using the Ilizarov as a method of distraction as well as for consolidation, and there are another methods like lengthening over nail, lengthening over plating, lengthening and then plating, and internal nail method. So today we are going to learn all these methods. It is very much impossible to do all the videos in a single, give all the content in a single video. So we will go by method, and finally we will discuss which method is better and what are the pros and cons of each and every method. So let's start with methods of limb lengthening. So there are various methods of limb lengthening as we have discussed. One is Ilizarov methods of limb lengthening. It is the pure Ilizarov method, where only Ilizarov rings with the help of wires is placed on the bones, and then we make a osteotomy, and then we use as a distraction, as well as during the other phases also we maintain this. Now another method is lengthening over nail. Here, along with the distractor, which can be Ilizarov or can be a LRS system, like in femur we use LRS system, and in tibia we use Ilizarov as a frame, and there is a nail inside. Another method is internal nail method, in which there is a motorized nail. We just put the nail inside the femur, which is basically used outside, and then there is motorized system to lengthen the bone. And then another method that is called LAT and lengthening. First we do the lengthening with the help of Ilizarov, and then we go for nailing and lengthening and then plating. So most common use methods are Ilizarov, pure Ilizarov method, lengthening over nail. Especially most economical method for stretcher limb lengthening, if you want to go for stretcher limb lengthening, cosmetic limb lengthening, then in country like India, the most economical method is lengthening over nail. And internal nail method, it's a very good method, but it's very costly. So when we talk about pure Ilizarov method, all the steps which we have discussed in last video, in which we have discussed about the science behind limb lengthening, it always remains same in each and every method. So what is happening here, if we consider a tibia, so if you are going for limb lengthening of leg, if you have limb length discrepancy, your one leg is shorter than the other, or if you want to go for stretcher lengthening and you have chosen the lower segment that we call as tibia and fibula. So friends, if you want to go for lengthening of a leg, and especially you are planning for tibia, so here you can see when we are going for tibia, and this is the fibula, the system here is pure Ilizarov method. All the methods will remain same. First of all, we need to make an osteotomy, as we have discussed. So in tibia, we will make an osteotomy at the upper end of the tibia. So upper end of the tibia, we will make an osteotomy. Similarly, in the fibula, we will make an osteotomy in the fibula at the lower end. So these are the basically osteotomy, which we have already discussed in the last video, where it's basically a fracture. We are creating a fracture. Now once the fracture, we have broken the bone, we need a system which will distract it at a specific rate. That is the whole science which we have discussed earlier, that we need to put an instrument, we need to put a system which will keep these bones aligned, and then over the period we need to distract this bone, that is called distraction phase, which will be at specific rate. The distraction has to be at specific rate. So various instruments can be used, but in pure Ilizarov method, you can see here we are using the rings. So they are the round rings, and with rings need to be fixed to the bones with the help of the wires. With the help of wires or sandspin can be used, as we all know. So this is, we make a osteotomy, then we put the Ilizarov ring, and now once this surgery is over, that is called latency period. We need to keep a period almost 7 days. Post 7 days after surgery, we start distracting. So we need to distract this. That is called distraction phase. The first phase is the latency phase. We have done the surgery. We have put the fixator, and now we need to wait for 7 to 10 days, and then we start distraction. That is phase 2. When we are starting the distraction, means we need to separate these two bones at a specific rates, which is usually 1 mm to 1.5 mm per day, so that lengthening can happen. So we need to distraction. You need to turn these bolts only, you need to turn these nuts only, so that usually we say that 4 times a day, or you can go for 3 times a day. You need to go for 1 mm, the full turn. The turn will be 1 mm. So now you can see over the period that there is a distraction. These two bones which we have created the fracture, now they are getting separated, and the new bone which is getting formed in between here, this is called regenerate. This is called regenerate, or the new bone formation takes place. Along with this, along with the bone, there are muscles, there are tissues, there are ligaments, there are tendons, there are arteries and nerves and veins. All these get also lengthened. We need not to make any fracture in that. Along with this, everything get stretched. So new bone formation takes place with the help of distraction, but all the muscles and soft tissues will get lengthened, they get stretched. That's why there is always a limit for lengthening. You cannot now say that you want to lengthen your tibia 12 centimeter. That is totally impossible. That thing you need to understand, and I want to make clear to all those people who are planning for limb lengthening surgeries that, friends, you need to stop at a specific points, because a deformed lengthened limb is far worse than a less lengthened but normal limb. If you have deformity after lengthening, then your lengthening procedure has failed. So it's better you get 6 to 7 centimeter but no deformity, then you are getting 9 centimeter but there is a deformity and you're not able to walk. You can judge yourself. So that is the whole method. So we will go for, this is the distraction phase, and this is the new bone formation, which is called regenerate. Bone will keep on lengthening, there is no issue with that. You can keep on just turning the nuts, it will keep on distracting. But the point where we need to stop is the stretchability of your tissues. So that depends on patient to patients. Sometimes a patient can go for, in a single segment, 7 to 8 centimeter, 9 centimeter very easily. But many times a different another person is not even able to go for 6 to 7 centimeter. So tissue flexibility is very important, and that is the point where we need to stop. If you see here, we will make a osteotomy here. I just want, same thing we are explaining here, that we are making a osteotomy in this area. We are making osteotomy in fibula, that is the fracture. Then we are putting a ring. When we are going for pure Ilizarov limb lengthening, we need to put multiple rings. It will not be like in lengthening over nail where we are just putting 2 or 3 rings. So we need to stabilize the our knee regenerate. So when we start distracting this, these two bones will get separated and the new bone formation will take place at a specific rate. So what are the phases of limb lengthening? As we have discussed in the previous videos, whether you are going for any method of limb lengthening, the phases will always remain same. When you put a Ilizarov ring, the latency period will be same. That is the period after surgery and before starting distraction. So we need to wait at least for 7 to 10 days. That will remain fixed for any method. Second is distraction. That depends on how much you want to lengthen. If you want to lengthen 5 centimeter, 1 mm per day, it means it will take around 60 days. So if you want to lengthen 6 centimeter, it will 60 days for lengthening. Along with that, adding the latency period, it will be almost 60 plus 10, 70. Usually we say that it will be 83 months for 6 to 7 centimeter of lengthening. So 5 centimeter of lengthening, it will take 2 months. If you want to go for 6.5, 7 centimeter, it is definitely going to take at least 90 days. Because over the period we need to decrease the speed. It is not mandatory that all the time we will keep on lengthening at the same pace. When your muscles and tissues or ligaments are getting stretched out, you might be in pain. Then we need to decrease the rate of distraction also. And once distraction means your lengthening is complete, in Ilizarov system we need not to remove that system. We cannot remove that system. Now we need to wait, as we have discussed in the previous video also. That is the consolidation phase. Now what is consolidation? As we have discussed, it is the new regenerate, the new bone which is formed in between the two ends. Now it need to get strengthened. It need to get strengthened to the same capacity of the previous bone, your normal bone, so that the bone will get strengthened and you will be able to walk, running, jumping, all the things possible later on. So that is called consolidation phase. In pure Ilizarov method, the consolidation phase is almost 3 times. Even in every method, the consolidation phase is scientifically it's 3 times of your lengthening. For example, if you are lengthened and you want to go for 7 centimeter, your lengthening is almost completed in 90 days, then your distraction will be 2 to 3 times, but ideally it is 3 times. So if you are lengthened for 3 months, you need to wait for 9 months before running, jumping, everything. That is distraction, consolidation phase. This is scientific data. So latency period before distraction, then we have distraction, we have gained the bone, that is called regenerate, and finally is the consolidation, during which your new bone which is formed, it get strengthened. In pure Ilizarov method, we need to continue this ring till consolidation is complete, and that is the major disadvantage of this method, that you need to carry that whole ring throughout the period of lengthening. Throughout all the period of lengthening, you need to carry your ring. That is the whole disadvantage. In Latian method, when we are talking about Latian, lengthening over nail method especially, after distraction, once your distraction is complete, we wait for 2 to 3 weeks more, and then we lock your nail at the distal end, at the lower end, and we remove the frame. That is in lengthening over nail advantage, that we can remove the fixator as early as possible, immediately after the lengthening is over, after waiting for 2 to 3 weeks. But in pure Ilizarov method, you need to understand that till the consolidation phase is over, we need to continue that Ilizarov frame, and that is the major disadvantage, that we usually didn't go for pure Ilizarov methods in limb lengthening until unless there is no other possibilities. So especially in case of stretcher limb lengthening or cosmetic limb lengthening, we didn't prefer pure Ilizarov methods. Pure Ilizarov methods, if you see the indications, what are the indications then? If you have limb length discrepancy, especially following the trauma, for example, you have injury to your knee joint also, and your limb is also shortened, and we cannot go for nailing there. When we cannot put a nail inside, then we have only one option. We can go for Ilizarov or the pure limb lengthening, whether you go for femur or tibia. Similarly, if your canal is very narrow, you are going for limb lengthening, you are going for stretcher limb lengthening, but your canal through which we put the nail is very, very small, then also it is very difficult to go for other methods, especially nailing method. Then we need to prefer the pure Ilizarov methods. And finally, if you have history of infection, like following fracture, if you have infection and then there is shortening, we should not go for nailing method. We should always go for Ilizarov method, because if we go for nail, then chances of infections, recurrence of infections are higher. So these are the methods today we have discussed about pure Ilizarov method, and in the coming video, which you all are waiting, we will go for lengthening over nail method. This is one of our case where we have done lengthening over nail, in which we have put the nail, we have made the osteotomy, we have put the nail, we have locked the nail at the upper end, the lower end of the nail is free, and we have put the Ilizarov fixator for distraction. And once the latency period will remain same, the distraction phase will remain same, and once the distraction phase is over, we will just lock at the distal end, we will remove the frame, that is lengthening over nail. I will discuss about this method in the coming video. So be sure to see our next video, because if you are planning for cosmetic limb lengthening, then in India, the most preferable method, and especially preferable by me also, because considering the economy, because this is the most economical method which we can go for at affordable prices, everyone can afford, whoever want to go for limb lengthening. So next method, we will go in detail of this method, lengthening over nail method, and most commonly preferred method in developing world. I am not talking about US and UK. Or you can afford, then you can go for internal nail method, because internal nail method, the nails are very costly, and presently they are not available in India also, and there is always scarcity of those nails, and they keep on changing. But till date, in spite of coming lot of internal nail, they also have problem. The most commonly done method, and the method which is time tested now, is lengthening over nail method, especially for cosmetic limb lengthening or stretcher limb lengthening. So friends, this we have discussed about pure Ilizarov method. Next video we are going to discuss about lengthening over nail method. So friends, if you have limb length discrepancy, or one limb is shorter than other, and you are planning for stretcher or you are planning for cosmetic limb lengthening, you can contact us. You can go to our channel and see all the videos. In the coming videos, you must see the coming videos where lengthening over nail method will be discussed in detail. And this is the only channel where limb lengthening surgeon is himself giving all the information. So this is the genuine scientific information. We will give you the completely research genuine scientific informations, and we will also share you the data for our patients which we have done over the period and what is our experience right now. So if you have any query, you can contact us. You can also drop the message if you want discussion on any other topic, and if you are planning for limb lengthening surgery, definitely contact us. So friends, thank you so much. Just subscribe our channels and share the videos. Thank you.